we're finding a point of vulnerability far more vulnerable than the head, the skull, or the brain itself. If, this is how we basically categorize it, if we have a force that comes into the head and it creates a blow to the head, we call it a concussion or an MTBI. It doesn't matter. It's from the front, it's from the side. If we get hit in the body or we whip our neck, we call it either a whiplash or a cervical acceleration, deceleration injury. The interesting thing is it creates the exact same fulcrum of force, whether the hit is to the head or the whip is to the neck. The fulcrum of force was the common factor between. We fulcrumed right between the head and the neck. It didn't matter where they got hit. It takes approximately 60 G's of force to cause a true mild traumatic brain injury where there's evidence of damage to the cortex of the brain. 60 G's of force. To give you a little bit of context, 2 full-size football players going head-to-head with a head-to-head collision is about 90 G's of force. So 60 G's of force to create a true evidential concussion where you can see the damage to the brain. It only requires about 4.5 G's of force to start to tear the ligaments in the craniocervical junction. That's a massive difference. So you have this place of high vulnerability in the neck and this fortress in your skull. And when we get hit, we keep saying it's the brain that's getting injured. It's got a hydrodynamic environment, it's got a fluid barrier, it's got a bone cage, and it's resistant up to about 60 G's of force. Starting to see where I'm going here? We're finding a point of vulnerability far more vulnerable than the head, the skull, or the brain itself. So with acceleration, deceleration forces, they're not only transmitted to the head, which do sometimes cause damage to delicate brain tissue. And we do see that, but they cause significant mechanical loss to the joints, muscles, and ligaments, and neurovascular structures of the cervical spine. So acceleration, deceleration forces to the cervical spine can occur from both direct and indirect impact to the head, the neck, or the torso. These acceleration, deceleration forces to the cervical spine occur within a fraction of a second.